preparation, realization, and understanding at the first ever Crystal 2023. Sri Sathya Sai Cardiac Care Technology Refresher Course for Advanced Learning. May now invite Dr. Rajesh Shenoy, sir, Dean of Allied Health Sciences and Physiotherapy, Rajiv Gandhi University of Health Sciences, Dr. Banajit Barua, Senior Consultant, Department of Cardiology, HSI Whitefield, Dr. Satish C. Govind, sir, Chief of Non-Invasive Cardiology at Narayana Institute of Cardiac Sciences, and Dr. Shrikant Sola, sir, Honorary Visiting Consultant, Dr. Rita Varyani, ma'am, Head of Department, Sri Sathya Sai Institute of Higher Medical Sciences, and Dr. Prayag, sir, Senior Consultant, Triple HMS Whitefield, to lead us in the invocation and light the lamp as we embark on this journey filled with enlightenment. May I welcome you? Shri Guru Bhyo Namaha Harihi Om Gananam Tva Ganapati Gum Havamahe Kavin Kavinamupamashravastamam Jeshtarajam Brahmanam Brahmanaspata Anashrinvannotibhis Siddha Sadhanam Prano Devi Saraswati Vajebhirvajinivati Dhinamavitrayavatu Ganeshaya Namaha Saraswatyai Namaha Shri Gurubhyo Namaha Harihi Om Sahasra Parama Devi Shatamula Shatankura Sarvagum Haratu Me Papan Durvadhu Swapna Nashani Kandat Prarohanti Parushah Pari Evano Durve Pratanu Sahasrena Shatena Ja Ya Shatena Pratanoshi Sahasrena Virohasi Tasyaste Devishtake Vidhe Mahavishavayam Ashvakrante Rathakrante Vishnukrante Vasundhara Shirasadharishyami Rakshasvamam Pade Pade Om Shanti Shanti Shanti. Now, may I call upon Dr. Banijit Barua, sir, Senior Consultant, Department of Cardiology, HSI Whitefield, to address the gathering.
I pranam the lotus feet of my beloved Bhagavan, Sri Sathya Sai Baba. Good morning, you all. It's a great pleasure to welcome you all, especially the cardiac care technology students for the Crystal 2023. What is the Crystal 2023? It is a refresher course. First time it has been conceptualized here. For the third year, this it is students before their final exam, which is coming in September 23. And all the topics going to be presented have been carefully selected from the curriculum. So it will be helpful for your exam and for future in your career. And each of the speakers, especially senior faculties, they are all national repute. And everyone going to talk to you today, they have extensive experience and well prepared to guide you for your exam. And hopefully at the end of the session today, you will have in-depth exposure and hopefully knowledge about the functioning of the newer echo machines. Now, new echo machines are 4D machines. They are very complicated. Artificial intelligence is there. And Dr. Shrikant Sola will guide you through that. And end of the day, you'll have knowledge about the echocardiography, rheumatic heart disease, congenital heart disease, and all the 17 segment models of the heart before you do any DSC exam, which is coronary supplies. And you'll have basic knowledge about the ECG in coronary artery disease, hypertension, TNT interpretations. You'll be able to diagnose AV block, arrhythmia, pacemaker programming, and all the interventional concepts that are going to be asked in your exam will be also thoroughly discussed. Of note, Sri Sathya Sai Baba opened this hospital for everyone, rich and poor. So everyone can get the best of care and best of service. See, this is a teamwork. One individual cannot offer the best care from the hospital. It requires the cardiac care technologists, the nurses, and doctors. Everyone has to give their best. So you must have passion and love for your work, what you do. For example, I'll give you a couple of examples because we have only 5 hours today. So I don't want to cut into your valuable timing for your learning lessons. I'll give you just a couple of examples that you see every day in the practice. One CCTA student is diagnosed dilated cardiomyopathy, EF 40%. It's very depressing diagnosis. You give 4 medicines, you don't know how many will respond. But another CCT technology comes in, says there is a Al-Kappa. So it's very hopeful. You do the surgery, 3 months later, you have a normal cardiac contractility, a normal LV. Now, other thing, very frequent diagnosis is LVH. So LVH is a very difficult to interpret. There are so many causes of LVH. Now, one large Chinese study, they have shown that in Southeast Asian population, incidence of HCM is about 1 in 200. It is given in JAC Asia. So we have proven that actually, whenever we see LV myocardial thickness is around 15 millimeter, we have routinely done MRI. We have diagnosed more than 100 cases in the last 1 year with HCM. So just because patients are severe aortic stenosis, it does not rule out HOCM. And we have come to know about this now. So many TAVR or aortic valve replacement you do, then later on we found out patient still has a big gradient. So whenever you see a 15 millimeter LV wall thickness, think about all this. See, this comes from the passion and love. I keep repeating this because that is what is lacking when we don't have a proper report. See, if you look at an echo report from Mayo Clinic, they have given electromechanical window. How many will you know? You won't be able to read this echo report, electromechanical window. What will you make out of this? But that is what is research and development. We have to keep up with this. This refresher course will prepare you for the exam. It does not mean you did not learn anything in your future. We have to keep updating ourselves every day. There's so much development, especially in cardiology. You have to keep up with this. So electromechanical window is a prognostic indicator in patients with long QT syndrome. This is very much important. Okay, at the outset, I'd like to welcome our guest of honor, Dr. Rajesh Shenoy, Dean of the Allied Health Sciences and Physiotherapy at Rajiv Gandhi University of Health Sciences, Karnataka. Yeah, 1 minute, Bragg, one minute, Bragg. Yeah. Sir, Dr. Shenoy, sir, your presence this morning in this refresher course for the CCT students shows how important this course is for the candidates before their final exam. I would like to welcome Dr. Srikant Chola, senior consultant cardiologist from our hospital, who has been trained some of the best institutes in the world, will guide you with his vast knowledge of non-invasive cardiology. I would like to welcome Dr. Satish C. Govind, the Director of Non-Invasive Cardiology at Narayana Hridayalaya, Bangalore. Dr. Govind is a doyen of echocardiography in India, a regular speaker in most, if not all, cardiology conferences in India. He will guide you through the echo in ischemic heart disease. And I'd like to welcome Mr. Anand M. from Boston Scientific, who will talk to you regarding pacemaker programming. Thank you, Mr. Anand, for taking your time off to share your knowledge for the CCT students. And of course, our in-house faculties, senior faculties like Dr. Rita Variani, who is the HOD of cardiology here. She's well known everywhere, and she's a very knowledgeable, will guide you for your refresher course. And Dr. Prayag Kini, who is an interventional cardiologist, senior consultant cardiologist, he will guide you through the interventional questions that they ask you for your exam. And our in-house faculties, Dr. Subramania Murthy is a post-DM, is completing his interventional cardiology, is very knowledgeable and very sincere. He will guide you with his cath lab procedures and cath lab materials that they ask you in the exam. Dr. Gyana Ranjan is also a post-DM in cardiology. He is interested in the structural heart and going very soon to Europe for training. And he's going to guide you to the ECG and ACS. And Dr. Deepak and Dr. Prasad, our DNB residents, they teach our CCT students. Last 3 years, they've been teaching them. So they are very well versed with what are the requirements for the exam. And our own CCT teacher, Ms. Yamini, going to talk to you about intervals in ECG. Last but not the least, which needs to be mentioned, is that refresher course, Crystal 2023, for the cardiac care technology. Before their final exam has been conceptualized for first time in this country by Dr. Rita and Dr. Prayag. They deserve a round of applause from all of us. Thank you, Sairam, sir.
Thank you, sir, for making us realize how important and how significant a very diagnosis is, and how in detail and how broader picture we should have when we look at something and diagnose something. We move ahead now. Saram Monandal. I'm privileged to introduce the Dean of Allied Health Sciences and Physiotherapy, Rajiv Gandhi University of Health Sciences, Dr. Rajesh Shani, sir. Sir has completed his bachelor's in Sri Bonendra College, Karkala, and his master's in microbiology from Manipal Academy of Higher Education. Sir has worked as a junior microbiologist in Manipal Hospital and was a syndicate member of IGHS. Sir was an academic council member in ITI University and member of Governing Council in Adi Chanchanagiri Institute of Medical Sciences. Additionally, sir is the director of Padma Shri Institute of Management and Sciences and Padma Shri Management Medicare Private Limited. Sir is an advisor of HKS International School. Sir is a member of Expert Committee on Research Proposal Grants. Sir is a member of Ethics Committee and member of Board of Studies. Sir is a syndicate member, Senate member, chairman, and member of Academic Council RGHS. We welcome you, sir, to give.
Good morning. Dignitaries present here, resource persons for the today's workshop, faculty members, students, and delegates who have come across different colleges from Karnataka. It gives me an immense pleasure to be with you today because there's a different kind of seminar or workshop or whatever refresher course, whatever you call it as, because this is what is the need of the hour. There are a lot of conferences or seminars which go on where only talking is being done. Hands-on skills, that is what is crucial for allied health sciences, is not available everywhere. The training is not available everywhere. So you are the few luckiest one who have got this opportunity to come here and learn the hands-on skills. In the coming days, I think in allied health sciences, more than degrees, the skill will take a precedence. So you need to learn the skills. That is more important. Merely having a degree will not take you anywhere. This is what is going to happen in the coming days. So I think you have made a right decision to join this refresher program. And I think whatever delegate fees or fee free, whatever it is, you cannot value this because this is an opportunity, especially for those students who don't have a clinical exposure, who don't get to work in this kind of setup. This is a boon in disguise for you. Please make the best use of it and take home the necessary skills what you or what your degree expects you to know. This is a good opportunity, use it. And in the coming days, I think there will be a Allied Health Science Council which will be in place and registrations become mandatory for everybody who wants to work across India. So even in Karnataka, I think by another month's time, we should have a council in place. Central council is already in place. So make the best use of the council once it starts, register. And also those who want to pursue their post-graduation or any other additional add-on skills, I think this is the right time after your graduation, you should do it. Don't expect this course, a refresher course, only for the exam point of view, because from further from exams also, these skills will help you out. Thank you, sir. So make the best use of it. And last but not least, I want to tell is this is an institution where I'm sure the students not only learning their skills, they learn compassion and empathy, which is more important for all allied health science students. And I think everybody should inculcate. That is the main spirit behind this whole institution. You need to have compassion and empathy when you are in this field. Please inculcate it. And I thank the management of this institution for giving me an opportunity to be with you and see this new kind of refresher program. I think many more institutions will take it up once this success is known. Everybody is liking it, learning it, and many more will start these kind of courses. I thank for inviting me here and thank you.
Thank you, sir. We are extremely pleasure to have you here, and I hope this journey is full of knowledge. May I request Dr. Banajit Barua, sir, to felicitate sir with a memento. May I now invite Dr. Rita Variani, ma'am, as head of Department of Cardiology, SSI HMS Whitefield, also an examiner for the Cardiac Care Technology course, to bring light to our students from the examiner's point of view.
Morning, one and all. Humble pranams at the divine lotus feet of our beloved Bhagwan, Sri Satya Sai Baba, who has given us the inspiration and the team to hold this conference. This conference was held at a pretty short notice, and hopefully in future the coming workshops will be on a different scale completely. I thank the faculty for joining us at such short notice, and also all the students. Dr. Prayag and the team here have put in a lot to bring this program to you today. So what does the examiner expect from the CCT student? And I would have put it the other way. What does the CCT student expect from the course? Actually, what you expect from the course when you begin the course is what the examiner expects from you at the end of the course. So we have a vision, right, when we start and when we join the course, that I will know ECG thoroughly, I will know echo thoroughly, I will know cath lab skills thoroughly, I will know EP thoroughly. And that is what the examiner expects of you at the end of the course, honestly. It's just that. Now, it's really I mean, in a nutshell, it's a paramedical program which offers you all the necessary theoretical and practical skills to assist the cardiologists in operating various medical equipment related to cardiology. That's like a definition of the CCT course. And what you are all going to become is experts in both the non-invasive and the invasive field. So what will you be doing as you train and when you pass out? So like sir has already alluded to, starts with an ECG, goes on to an extended and expanded ECG, that is the Holter, the stress tests, that is a TMT, goes on to echocardiography, that is the ultrasound of the heart. And sir has already alluded, Dr. Baru has already told you examples of how one finding like the LV hypertrophy can be interpreted by different students as per their skills in different ways. LVH could be because of hypertension. It could have a CoA underneath it. It could be an HOCM. It could have aortic stenosis. So finding the etiology is extremely important. That diagnosis could start with an ECG, where you diagnose LVH on ECG, could go on to an echo, where you are able to visualize the other structures associated and then come to the conclusion as to what is the cause of this LVH. And if you miss something, then there goes the diagnosis. And then it leads to a different route. So actually CCT course is extremely important and is gaining even more importance nowadays in all the hospitals across the country, where the primary person doing the echo might just be a cardiac care technologist. So before the patient is seen by a doctor, there's a possibility that the CCT student or the CCT staff see that patient first. And that is how critical your correct diagnosis is. So then we, in the coming third year, there are newer technologies which are added like stress echo, DSC, strain, a bit of 3D is also there in the portions. Strain mapping is there in the portions. Contrast echo is there in the portions. So all these are advanced echo techniques, which we may be touching upon now, but then we'll have to have an advanced learning for all of this. And then, of course, because echo is so important in emergencies, in the cath lab. And then this is how close you will get to the patient. That is, in the cath lab, working with the doctors, with the materials of the cath lab, handling the table, guiding the doctors into the views and the the procedures, giving the right material for the right patient. And then further going on to electrophysiology, where some of you eventually might choose your careers. And these are the procedures done commonly, which all of you might have seen or will see in your lives. And the end result is that all of you will be fully qualified. And that is what we'd like to see when we take your exams, both theory and practicals after your third year. And eventually, I think there'll be an exam even after internship as an exit exam. So this is how complete your knowledge must be and should be. It's not fair to say that one could learn a part of it and then be complete, because you are all joining this course soon after 12th standard, and it's quite a challenge in that sense. However, I know that our CCT students and across the country, CCT students are learning what doctors would learn. And you are able to cope up with it. That's because that's how bright and young and enthusiastic you are all about the course. So the key is to continue to be enthusiastic and passionate about your subject. Love your subject as much, and that is where you will be able to learn what doctors have been able to learn over several years. You're all getting it as a crash course, and you're like doing an excellent job of it, honestly speaking. You're all doing very well in getting to the right diagnosis, getting the right direction, guiding the doctors in the right way. So all of that comes to you naturally. Maybe I think that's the love you all have for the course. So you're all going to be extremely skilled and goal-oriented professionals and are really going to do very well. So won't take much time because the sessions should be starting now. And honestly, you will all be contributing a great part to the medical care across the country. So these are the expectations of from a CCT student. Now a very busy slide. We can't go through it all, but it's just what I've told you. If you see your questions of third year from your question bank, and you know that these are the questions, you know how exhaustive it is. Everything is covered. So that is what is expected. But then you have to take it step by step through your course. Take it one step at a time. Do your first year properly. Go to your second year. Do it properly. And feel free to ask doubts throughout your course and even today. Thank you all and all the very best. Saira.